I've worked in early childhood education for the past 26 years. I'm actually a certified teacher and have taught in various arenas of public, private, and faith-based education situations. I currently own child care centers and preschools, so I firsthand see the fruits of the labor of the nurse-family partnerships. They are key components to the earliest impact on children's lives. When the nurses go in and make relationships with the families, the parents, the children, even extended family members, they're not a Band-Aid. So many programs are Band-Aids. This is systemic. They take the time to know the family, to know the children's needs, the parents' needs, and make a comprehensive plan on how that family will succeed as a unit, so that we can in turn see that child succeed as a member of South Carolina and a productive citizen.
Well, the wonderful thing about nurse-family partnership, and especially here in the state, is number one, it is bringing quality of life to our mothers in the state of South Carolina, as well as the young people that they're bringing into this world. And thirdly, I look at the savings, overall savings that it is to the state of South Carolina for these mothers and children to be well taken care of.
Well, I think it's a wonderful program, and it makes sense, literally and figuratively, as far as the economic impact that is given back, the 1 for 9.5 ratio in payback, but also it makes sense from the human touch standpoint and going directly to that mother and to that baby to try to have a one-on-one impact in changing lives in that family. So I wish we had more nurse-family partnership centers and partnerships in this state, because we're needed. It's needed when you consider the poverty rate in South Carolina and the number of unwed mothers, and so we really need nurse-family partnership.
They have. When those private entities partner with groups, they can make such a huge impact. You know, there are a lot of programs out there that piecemeal things. This is a program that puts everybody at the table for the good of the children. And Duke and Blue Cross Blue Shield, they really believe in the family unit. They believe in helping that child at its earliest stage. And when we do that, we're going to see a huge return on our investment. Those children will succeed throughout their educational life, not just in one arena of early childhood. And that's what we're after. We're after those children to be lifelong learners and productive parts of our society. And the nurse-family partnership actually brings the family unit along as the parents get better education, as the parents raise their employment levels, so that the children's opportunity and the parents' opportunities increase together. And that's where we're successful. And I really thank Duke and Blue Cross Blue Shield for seeing a long-term solution to this problem instead of a Band-Aid.